Hi guys, we're back with sessions 50. What if you were the nurse? And today the topic for discussion is, what if you were that new nurse who was given an unfamiliar assignment? You wind up taking a report and nothing seems to make sense. You handed a patient with a diagnosis of DVT and atrial fibrillation. What exactly does DVT mean? What exactly does atrial fibrillation mean? And then we're going to talk about an overview of heparin and its uses and DVT and prevention. So let's get started. Here we have one nurse giving report to the other. She's telling her that the patient she's going to be in her care is going to be given has a diagnosis of atrial fibrillation and DVT and is on a heparin drip. To her, this does not make a lot of sense. She's saying, I'm new, so this means nothing. So let's give an explanation that might be valid if you were in that position. First of all, what exactly is atrial fibrillation? Well, it's one of those cardiac arrhythmias. It is not as uncommon as we think it is. If you look at a normal EKG, you will see there is a P wave. What is an interesting phenomena in the atrial fibrillation? There is no P wave. There's just a coarse wavy line. The P is absent because the sinoatrial node, which is the pacemaker of the heart, is not doing its job properly, and an irritable focus somewhere else in the atrium takes over that job. Next we talk about heparin. Well, heparin is an anticoagulant and it is used in the prevention of blood clots. What is happening, it actually is used in atrial fibrillation because people can have blood clots as a result of ineffective emptying of the heart, of the atrium. Now, heparin, being an anticoagulant, might cause bleeding. You might get bleeding from the gums, bleeding in the urine, hematuria, bleeding from IV sites, bleeding also from incisions. Bear in mind that the patient in atrial fib is also at risk for stroke. A blood clot might just leave the heart and travel to the brain. So all around, a patient with this sort of diagnosis, you should really try to do as accurate an assessment as you can. Pay attention to things like whether this patient is having any bleeding. In the case of this patient, we can see there is bleeding coming from the dressing. Possibly there's blood in the urine as well. Check the gums, see if there's any bleeding coming from the gums. Normally, you know, I don't have to tell you about your documentation and whatever method your unit uses for notifying MD or whoever is in charge of your findings. Next, we're going to talk about the patient with deep vein thrombosis. Well, there's also prevention. Here is a patient who had surgery 2 days ago. She hates to wear her TED hose. Well, that's her decision, but you've got to do what you've got to do. It is important for her you've got to explain to this patient that she may not like wearing TED hose or her sequential stockings, but what happens if she gets a blood clot? TED hose is sometimes used depending on the situation. Sequentials are sometimes used depending on the situation, but ultimately the result is the same, preventing blood clots. And we all know that often the doctor writes orders to encourage patients to move their legs in bed also. That is very helpful in the prevention of blood clotting. Well, if you have a patient who is on bed rest for a long time and suddenly calls you and said, "Nurse, I'm having pain in my calf," please be aware that this is not the sort of thing that you immediately start treating with pain medication. You should really assess the calf and make sure there is no heat and tenderness in that area, and make sure that that's not the formation of deep vein thrombosis, because it's very possible. And if you'd like to learn more about deep vein thrombosis, I suggest you go to dearnurses.net and take a look at the clinical setting step-by-step chapter 3. There's plenty of helpful information there. So once again, if you have a patient who's got heat and pain in the calf, you may want to do a full assessment and let the doctor know your findings, because it's very possible a blood clot might be the cause of that heat and pain. Stay posted for more clinical information and hope you have a good week.